how did this theory about Tylenol and autism even emerge? And what drew the entire scientific community's attention to it?
Well, I think quite a few years ago, people did start to explore all the different kinds of potential environmental factors that may be contributing risk for autism. And that would include things like diet, things like pollution, things like that. And also, most particularly, medications. We've always been concerned about whether medications taken during pregnancy pose a risk to the fetus. And in fact, we know they do. So it's not surprising that people have looked at Tylenol. They looked at it alongside other pain relievers. And the conclusion had been that compared to other kinds of pain relievers, such as aspirin or Advil, in fact, Tylenol is really the safest one to be taking during pregnancy. That said, it's always been with the clear presentation that just take the minimum amount that you need. Don't be sort of taking an excessive amount of Tylenol. And the research shows that there is an association between taking Tylenol and a slight increase in risk for autism. But of course, you have to ask the question, why is a pregnant woman taking Tylenol? And one of the main reasons they're doing that is because they have some sort of an infection. They may be running a low-grade fever. And so they take Tylenol based on the recommendations from their gynecologist, obstetrician.
But could the cause, the infection or whatever
Well,
they have, be the problem, and the Tylenol is just,
exactly.
right,
So,
causation, correlation. I guess that's the issue.
so when people have looked at this in a far more careful way, as opposed to a really just let's take one blunt instrument to looking at very complex questions, in fact, yeah, that's why women are taking it. And we do have strong evidence that having a fever, inflammation, all kinds of during certain periods of pregnancy are associated with an increased risk. So the conclusion of the scientific community and the medical community has been take the Tylenol, not for an excessive amount of time, but you're better off taking the Tylenol than allowing the fever and the illness continue. Even if you're just taking Tylenol for pain, which is what many people are doing, again, it's better to take it. You don't want to be suffering from pain because that leads to stress, and stress itself is not a good thing to experience during pregnancy. So that seems to be the story. There may also be some associated risk that's related to how Tylenol interacts with the sort of what we know is a much bigger contributing factor, namely genetics. There may be some factors going on there. So in the best studies that have been done, instead of comparing typical controls, just any other women, they do a sibling comparison. So a woman who had already, one child with autism, but a child without autism, the sibling control paradigm, we do not find an increased risk for autism.